We are here at La Fontaine Aesthetics in Cherry Creek North with Dr. Ken Olasek. Thanks for having us, Ken.
Oh, thanks for coming.
Okay, so the top two treatments that you have at La Fontaine are Botox and fillers. Now, most of us know what Botox is, but what are fillers?
Well, fillers are products that's a gel that we inject under the skin. They plump areas, they fill lines, and they lift areas by adding volume.
So, Dr. Olasek, show me where some of the places are that you do filler.
Well, we do fillers all over the face. The most common areas are this line that's called the nasolabial fold that goes from the nose down to the lips. That's common. That gets deeper and shadowy as we get older, and we take that shadow away. Also, we fill the lips to give them a plumpness. We do a lot of fillers in the cheeks because as we get older, we lose volume in our cheeks and it makes your face fall.
Yep.
So if we add some volume, it actually lifts the cheeks and gives you a rejuvenated look. Other areas that are very popular are the lines that we call lipstick bleeders around the mouth, the smile lines, we call them cascading smile lines that go out like that.
Yeah.
And then some of the new treatments that we use, which are very exciting, that have really taken away eye surgery a lot, is we use fillers in the dark hollow underneath, and then we add volume up on the top eyebrow, and it lifts the eye. So you get like an eyelid lift without surgery by using fillers. And when you combine that with Botox, you get a really good look. Other areas off the face that are very popular are hands. Hands are getting more popular because as you get old, you get a veiny look, and adding some filler in there kind of disguises the veiny look.
So, okay, big question, how much does it cost?
Well, it depends on the areas we treat, but it can range from anywhere as low as $400 up to $1,200, depending on how many syringes you use.
Sure, sure, and how many places you need to fill,
That's right, that's right.
And then how long does it last?
Well, you do have some really safe ones that last 6 months to a year. And the nice thing about those is if you don't like it, you have dissolving medicine that you can immediately take them away. So they're very safe and they're good for new people that are new to this arena. There are some new fillers like Artifil that last for over 7 years. And those are for people that have had fillers and are sick of getting it done every year.
Every year,
like that.
yep. Yeah. And so when you say 7 years, gosh, that's a long time. What does that whole process look like? I know that you have to be tested first, is that correct?
Yep, you have to have skin tested so you don't have any allergies. And then you kind of go slow, maybe take 1 or 2 appointments because you really want to make sure you don't overdo it with the permanent one. But it pays off in the long run because you'll need less treatments in the long haul.
So the products that are fillers that aren't permanent, like Artifil, what are they made of? And how does that compare to Artifil?
Well, hyaluronic acids are the most popular, and there's 2 main brands, Juvederm and Restylane, and there's soon to be a new one called Bolatero that we're excited about. And they're a little bit different. They're kind of like cousins, close to each other, and you can use them very similarly. And they're made from a molecule that we have in our knees called hyaluronic acid, and they just use some cross-linking to make those molecules last a little bit longer. And then you go on to Radius, and that's a calcium product that we use, and we've used it in other parts of the bodies.
Are there any side effects with fillers?
Well, it does hurt a little bit more than Botox when you have it injected. And then whenever you put a needle under the skin, you can get some bruising. Usually it's not very much, but it's possible. Other things are you can get some lumps that are easily correctable, but as long as you follow up and return for a follow-up visit, we can take care of those here.
Well, let's talk about Artifil. What's the difference between what makes it permanent? What makes it last 7 years compared to the other products?
Well, compared to the other products, Artifil is made out of a synthetic product that really gets incorporated into the skin as opposed to slowly being degraded. So there is a long durability with it because it grows into the skin and should stay there for a very long period of time.
So there must be a cost difference between Artifil and the rest of the fillers.
There is. I mean, there is an upfront cost, and it's about double the cost up front, but if you say you only need 2 treatments over 7 years as opposed to 7 treatments, it still works out in the long run to be cheaper.
And do you like this product? Are you excited about it?
Oh, Artifil's great. I have Artifil in my face, and it's one of the most smooth products that I've used. But you have to go with someone that's used it a lot. We've been using it for over 5 years here. So it's a very specialized product.
I'm starting to look in the mirror and go, I'm tired, I'm not me. This person looking back is not the person that I am.
When you take care of your skin, that's only one component of skincare. You need to address muscle tone and your skin texture as well. Having Artefill is a great addition to skincare.
The natural feel of Artefill, it was remarkable. I was really concerned that I might have a lump or a bump or not really know what to expect with it, but you can't even tell that you've had anything done at all. You don't feel it underneath your skin. It didn't break my skin out, and I tend to be have a little bit of sensitive skin, so I had a concern about that. Didn't have any of the problems.
Are there any side effects? Are there any worries with Artefill that you tell your patients about?
Well, we always worry about allergic reactions, so we skin test before. And then second of all, you don't try to correct 100% with Artefill. It takes a couple treatments to get where you want to go because you want to do it very carefully. So it's a little bit slower of a process. You won't get the 100% correction first off.
And joining us now is a patient of Dr. Olasek's, Frankie. Thank you so much for joining us, Frankie. Okay, fillers is what we're talking about today. Why do you love them and what do you get done?
I love the fillers because it actually makes me feel and look refreshed. And you don't really see the smile lines that come with age, so I'm a little bit vain, and that's my #1 reason why I do get the fillers. I get them here, and I've had them down in the smile lines and a couple of injections with my lips, but that's been a while.
What is it like to get a filler? Does it hurt a little bit, or what's it like? And for most people have had Botox, so how does that compare?
It's very similar. It's just you can actually feel the filler going in, and it doesn't hurt. It doesn't, for me, I don't get any type of blocker. I'm pretty tolerant to pain, but it doesn't hurt.
We're going to treat Frankie today, her line that goes from the nose down to the corner of her mouth. That's called the nasolabial fold, or the smile line. And in addition, we're going to do a little bit in the corner. If you can see here, right at the corner of her mouth, she has a little line that goes down. We're going to plump that up and give her smile more of a neutral effect so it doesn't look like a frown. We're going to lift that up like that, and we're going to lift up that line like that. Well, we have lots of options at La Fontaine, but the two most common ones we have are Restylane, which is a filler that lasts about a year and is very safe and very popular for the beginners. And then we have Artefill, which is more long-lasting, lasts up to 7 years. And once you have a treatment with Restylane and you determine that you like the results, then it would be time to consider going to Artefill. Poke. We've just completed treating the left side of a nasolabial fold in the corner of her mouth. And you can see how more shallow the valley is on the nasolabial fold in the mouth, and it looks less deep compared to the untreated side, which has a deeper valley and a deeper corner of the mouth. Okay, and what we're going to show here is the next treatment is we're going to treat this corner of the mouth. You can see the corner of her mouth down turns. Poke. And you can see how the corner of her mouth is less downturned and she has less of a deep line right there now.
What attracted you to Artefill?
Because of the long-lasting
Yeah.
effects on it. So I won't have to come in every 3 to 4 months or 6 months to get it done. So hopefully this will work.